that's allocated for the IMST. And I would like a feedback from you. I use 3 English adjectives will give you tranquility, serenity, perfect environment. So I want you to confirm it. With this, allow me to invite Daniel to Dr. Daniel, which is his Executive Director for ADI, also to warmly welcome us on behalf of the House.
I will stand on the established protocol as I make my brief remarks. And before I make my remarks, I wanted to introduce 2 senior colleagues who have joined us from the IDI and the Makerere community. The IDI, as you can see, is based on the main campus of Makerere University. And this morning, we've been graced by the presence of the Deputy Vice Chancellor for Finance and Administration, Professor Henry Alinaitwe, who's with us, representing the Vice Chancellor. And I want him to. We've also been joined by the Chair of the Board of Directors of IDI, who is a former professor at the university, but who is also the chair of the Government of Uganda Education Service Commission, Reverend Professor Dr. Sam. Most welcome. So shortly after 12:30 a.m. on a Sunday, 20th September 2020 to be exact, the iconic ivory tower of Makerere was gutted by fire. The term ivory tower is not always seen in a positive light, because sometimes universities are seen as otherworldly and not directly concerned in the daily affairs of our communities. This morning, I'm very proud as the current director of this institute within one of Africa's premier universities to welcome you and to say that we are proud to host this Continental Incident Management Support Team. We hope that by hosting this center here, we'll continue on the journey of providing a model of how academia can engage and address societal challenges. For us, this journey started more than 20 years ago when our continent was faced with the formidable challenge of HIV and AIDS. For the last 2 decades, the IDI has been supporting the government of Uganda to address this challenge, and today I am proud to say we are a leading implementer of the Ministry of Health, using resources from our partners that include the US government, here represented by the Charge d'Affaires and the Department of State. And Mr. Vice Chancellor, I'm proud to tell you that IDI is responsible for almost 10% of the oversight for the national HIV battle. And I think that's a contribution the university should be proud of. In 2016, as part of our process of always scanning the environment and to maintain relevance, the IDI created a global health security program. This is because we saw the increasing frequency of outbreaks on this continent, of course driven by the biodiversity of the continent, the population pressure, economic activity, and of course, civil strife. With the onset of the COVID-19 outbreak, IDI was able to competitively obtain resources from Africa CDC for the Saving Lives and Livelihoods program. And I'm proud to tell you, Dr. Alinaitwe, that the IDI was the Continental implementing partner for research for the Saving Lives and Livelihoods program. This is what has given us an opportunity to forge a relationship with the Africa CDC. Honorable Minister, we were delighted because of the relationship we built with the ministry. when the government of Uganda indicated that they would be keen to host such a center, that the Ministry of Health pointed the Africa CDC team in the direction of the IDI. We want to thank the ministry for that vote of confidence, not only in IDI, but in Makerere. Honorable Minister, as you come back to Makerere, which I know is your alma mater, because I remember a few years ago, I was a young doctor, medical student, and I used to see you on the medical school campus many years ahead of me. I hope you really appreciate the transformation that is going on here at the university, and particularly here at the IDI. And I hope that this gives you a lot of courage that academia can continue being relevant. And before I come to the close of my remarks, I really wanted to recognize a special individual who has joined us this morning. This individual was critical to the founding of this institute where we are launching this event. He was not only the leader of the Ugandan group that partnered with US academics to found this institute to build capacity in Africa, but he was also the chair of the inaugural board of the institute. And he is now an emeritus professor at the College of Health Sciences. This is none other than Professor Nelson Sewanka, and I'd like him to stand up for recognition and to
Recording in
unequivocally
progress.
say that if it weren't the vision of Professor Nelson Sewankambo, Professor Mal Sandy, and your colleagues, we would not be here at this moment at the IDI. And I hope being here to witness this gives you great encouragement. Our work at the Institute has been supported by many partners who are here. I've already pointed out our partners from the United States who have supported programs across HIV and AIDS, global health security. They've also supported the establishment of a data science center. It's an African center of excellence in data science and bioinformatics. It's an asset we're proud of because there are only two such assets in Africa, one here and one in Mali. The center is already programs and has also attracted the attention of world players like Google DeepMind. And a few months ago, we had delegations from all over Africa, young scientists who are the next responders to outbreaks, using science and maths to predict the next outbreak. I want to thank our UK partners. I see the ambassador is here, and we've received a lot of support from the FCDO to establish our programs. So I could go on and on, but Honorable Minister, today is to welcome you at Makerere on behalf of the Vice Chancellor, and to say, as our motto says at Makerere, we build for the future. Welcome to Makerere. Thank you.
Another round of applause for our host. But again, ladies and gentlemen, the time has come for one message, one team, one leadership. But it was not possible. It was possible because many, many partners decided to work together. And allow me just to look into this. You see, these are the key partners. But there are some partners who are working on the ground. We have UK Health Security being represented here by none other than High Commissioner of UK to Uganda. The 11 countries that has been brought here to discuss one of the critical areas, how to strengthen it, the cross-border surveillance, how to build trust among member states. as an outcome of the high ministerial meeting. It was made possible with UK Health Security. Japaiko, I don't know who's representing Japaiko in this room. Yes. So thank you again for really significant financial contribution for the setup. The US CDC government, who is represented here, well, thank you again for stepping up and for supporting the setting up this. AFNET, who is representing AFNET here, it would not be possible to have this beautiful. Thank you so much. So again, we have JPACO, we have UNAPA, we have UNICEF, we have World Bank, we have IOM, we have European unions and also the African unions and many. We will find way to accommodate all of you to have few words. But the only disclaimer, let it be at 3 minutes, just to make sure that all of us have an opportunity to celebrate this particular moment. So with this, I would like to start first with the representative of JPICO to come forward to give us a few remarks, and your 3 minutes start right now.
My 3 minutes, I think, are nearly over. Minister Chris Wadiomonsi, the senior government officials led by the DG, the Vice Chancellor, Makerere University, and your faculty. Allow me to use the protocol that has been established and distinguished ladies and gentlemen. It's a great honor for JPICO to join today as we launch the Continental Incident Management Support Team. This milestone reflects Africa's growing capacity to lead coordinated, timely, and evidence-based responses to public health emergencies across the continent. On behalf of the President and leadership of JPICO, I extend our sincere appreciation to the government of Uganda and the Ministry of Health, specifically the Africa Centers for Disease Control and Prevention, the WHO, the US government, and all implementing partners for your unwavering commitment to preventing, detecting, and responding to the current Ebola outbreak and strengthening health security across Africa. Today's launch is not only about responding to an outbreak, it's about building strong systems that enable countries to prepare for, detect, and respond rapidly to future public health threats while protecting the health and well-being of our communities. We are proud to have contributed to establishing the Continental IMST office, building on the long-standing partnership we have with Africa CDC, the Ministry of Health, the US government, and many other partners. Today, JPICO reaffirms the CDC, the Ministry of Health, and all partners in supporting this response and future public health emergencies. Thank you very much.
So can we give him a big round of applause? He served us 20 seconds. Can we put our hand together for him? So next, allow me, ladies and gentlemen, also to invite one of our public health security champions in East, Central, and Southern Africa. The Director General is here. If he can come forward for his 3 minute, which is to start right now. but is a champion of the cross-border surveillance, and that's the reason he's here.
Thank you very much, Dr. Aru. Honorable Minister, distinguished guests, colleagues, ladies and gentlemen, good morning. Allow me to thank very much the government of the Republic of Uganda and all the partners who have been mentioned here for this historic moment on the incident management supporting team launch. We as EXA, East Central Southern Africa Community, would like to join this movement, which is very important for us. And I believe it is through solidarity with the people within the continent and outside the continent we shall be able to win all the fights against all the diseases, not only Ebola, but other diseases which are of the challenge to the continent of Africa. So I'll stop there, but I'd like to affirm our commitment to this undertaking. Thank you.
Well, thank you, TG. There's one thing that he did not mention. EXA accepted to serve as a strong member of the surveillance pillars. So he also decided to dedicate a senior technical officer to be based here with IMST. So thank you again, sir, for that. So next, allow me to, I don't see the UNFPAs in the house. Thank you again for your partnership, for your commitments. You've been part of the high-level ministerial meeting on the cross-border surveillance. And also you make a commitment to support the cross-border surveillance. So it's my great privilege to invite you to the podium to give your brief remark, your commitment, your fashions, and your 3 minutes to start right now.
Honorable Chris Barry-Moonsley, Minister of Health, we're happy to say. Excellencies, representatives of African Union member states, of Africa CDC, representatives of the United Nations, of the Ugandan Ministry of Health, colleagues, friends, I'm very deeply honored to be here today to deliver this message on behalf of the UNFPA Regional Director for Eastern and Southern Africa. Today, we stand in absolute solidarity with the governments and the people of this continent, and particularly the Democratic Republic of the Congo and the Republic of Uganda as we navigate an evolving Ebola virus disease outbreak. As an active partner in the Continental Incident Management Support Team, UNFPA affirms its commitment to this coordinated, continent-led response. We commend the leadership of the African Union member states, of Africa CDC, of the World Health Organization, and of all the partners. The launch of this physical space for the IMST is a reflection of that commitment. We, of course, appreciate that the absolute immediate priority for all of us is to halt the transmission of this virus, contain its spread, and bring the outbreak to an end. At the same time, experience has taught us that we cannot fight a health crisis with a single lens. It is absolutely critical that we simultaneously ensure the continuity of all essential services. These include sexual and reproductive health services, and we must vigorously attend to other risks, including the gender-based violence that potentially can rise during such outbreaks. Our mission is to ensure that no pregnant woman should lose her life due to a preventable complication because an outbreak disrupted her care. UNFPA is therefore prioritizing the protection of frontline health workers, including midwives and doctors. UNFPA stands shoulder to shoulder with the African Union, Africa CDC, WHO, the government of Uganda, and of course Makerere University, and all the member states. Together, as we work to halt transmission, we must simultaneously safeguard the essential health, dignity, and protection of women, girls, and young people. Thank you very much.
Can we put our hand together? Very simple message, but very strong. One preventable maternal death is one too many. And thank you again for working so hard, UNFPA, to support our children and our mothers. So next, allow me also to invite, is the representative of World Bank is in the house? Yes. So allow me to recognize the World Bank for continuous supporting all the 55 African countries, and also for being one of the main supporters of the work of the Africa CDC that we do. So let's put our hand together for World Bank.
Honorable Minister for Health, our Director General, distinguished representative of governments that are here, leaders from Africa CDC, WHO, development partners, ladies and gentlemen. On behalf of the World Bank Group, it is my privilege to convey our goodwill and strong support on the occasion of the official launch and physical operationalization of the Continental Incident Management Support Team here in Kampala. This milestone reflects a powerful commitment by African institutions and the global community to strengthen coordination, accelerate response efforts, and safeguard lives in the face of the ongoing Ebola virus disease outbreak. The establishment of a fully operational Continental IMST in Uganda is both timely and strategic. It brings partners closer to the epicenter of response efforts, enabling real-time coordination, faster decision-making, and more effective deployment of technical and financial resources. As we have seen, outbreaks demand not only speed, but seamless collaboration across countries, institutions, and response pillars. The World Bank has long supported countries across the region to build the fundamentals required to detect, prevent, and respond to health emergencies. Strong surveillance system, resilient laboratories, trained health workers, and robust public health institutions. These investments are now being put to critical use in responding to this outbreak. Today's launch reinforces a key lesson from past epidemics. Coordination is as important as capacity. By bringing Africa's CDC, WHO, national authorities, and development partners under a unified incident management structure, the IMC strengthens our collective ability to mount a comprehensive, coherent, and effective response. We commend the government of Uganda for its leadership and continued commitment to transparency and rapid action, as well as Africa's CDC and WHO for their steadfast coordination at the continental and regional levels. We also recognize the tireless effort of frontline health workers and communities who remain at the heart of the response. The World Bank is taking a two-tiered approach to this response, working with regional organizations, African CDC and ECOWAS, on priority cross-border interventions in line with the Continental Master Plan, and working directly with national government to support the implementation of national response plans. In this context, the World Bank management is closely supporting country offices in Uganda, DRC, and at-risk neighboring countries to leverage existing operations and emergency response mechanism to support the response, and have approved funding from ongoing programs to the tune of $100 million, and are currently considering additional funding in response to requests from governments. As we operationalize this IMST, let us remain guided by a shared purpose to contain this outbreak swiftly, to protect vulnerable communities and to build stronger, more prepared health systems across the region. Together, through solidarity and coordinated action, we can succeed. Thank you very much for the opportunity.
Thank you so much from the World Bank. Next, allow me, ladies and gentlemen, to invite also the representative of IOM, if he's in the house.
Thank you very much, Mr. Moderator. Honorable Minister of Health, Honorable Chris Beramusu, distinguished representative of the government of Uganda, the Democratic Republic of Congo, and South Sudan, Director General, Africa Center for CDC Control and Prevention, distinguished executives from African Union, honorable guests from the US government, UK government, European Union, colleagues from the UN and partners agency. Ladies and gentlemen, good afternoon. It is my honor to represent the International Organization for Migration and the IOM Regional Office at the official launch, physical operationalization of the Continental Incident Management Support Team here at the Infectious Disease Institute, Makerere University. Thank you to the government of Uganda, Africa CDC, WHO, and all partners for convening us at this critical moment for the regional health security. IOM stands in full solidarity with the Continental IMST and pledge concrete support across two complementary pillars. As the lead of the Continental POE Technical Working Group, IOM remains committed to practically collaborative solution. Let us set this platform to align our action, share lessons, and ensure our collective response prospect lives, preserve dignity, strengthening regional resilience. Thank you very much.
Thank you so much. He served us 40 seconds. Thank you so much. So next, ladies and gentlemen, allow me at this point in time to invite the representative, the High Commissioner of the UK to Republic of Uganda to give us the solidarity message and commitments of the UK government. So,
Honourable Minister, Director General, please permit me to stand on existing protocols. This is a hugely significant milestone. Was anybody here at the Speak event in Manyono? Does anyone remember that? Just about a month ago? Put your hand up if you were there. So we were talking about it. Uganda was offering to host the IMST after a conversation with His Excellency, and we are here, and that is impressive. Now, all speakers, the speakers from the government of Uganda, from the government of DRC at that time, from the government of South Sudan, WHO, Africa CDC, there were some really important messages then. It was about an Africa-led approach, and we're seeing that in action. And there's another message that comes out every time we get together. MC talked about one team, one leadership. When we had the opportunity for a brief exchange with the Honourable Minister this morning, the Honourable Minister and the Deputy Vice-Chancellor here of Makerere reminded us how many proverbs there are in Uganda and other languages for collaboration. And Honourable Minister, I'm going to test my Luganda on you because there's one that I think fits very well, which was Agali Ewamu Gegaluma Enyama. Is that okay? Yeah. So that means to those that don't say, it's the teeth that bite together chew the meat. I'm impressed in these meetings, in difficult times, we see what we can do together. So, and let us also briefly remember those that are in the field and in capitals working tirelessly to provide a professional response. Now, this is the start of a marathon. We've heard many priorities wherever we are and tailoring our support to the greatest need. The UK's committed over £27 million so far regionally, and the majority of that has been dispersed with partners already working hand in hand with governments to accelerate and coordination, surveillance, case management, risk communication, and more. Now, the regional director of the WHO, Mary Roslin, reminded me that success starts or stops in the community, and that we need to not lose sight of the fact that support needs to go beyond treatment for Ebola in the communities if we're going to build up trust. That support needs to go beyond those specific treatment centres. So Director Mary Roslin, we hear you on that. And I'm reassured by the presence of all of the partners, including Makerere and IDI. I do feel calm whenever I come to Makerere somehow, but it's not just about the leafy atmosphere, it's about knowing that the credentials of Makerere and IDI are involved in the research and development that will help think about the future as well. Let me close by saying this is a whole of government support from a UK point of view. I'm very proud to be here with my colleague, Dr. Bayard from the UK Health Security Agency embedded into Africa CDC. We have a contribution obviously through the multilaterals as well. We look forward to IMST delivering on its intent and its vision, and we know it will, and we stand ready to support. Thank you.
No, thank you again. You know, we are coming to ambassadors, we're coming to politicians. The speech is going to be even more sweeter. Thank you again for commitments and for your clarity. So next, we also invite another politician, the ambassador of United States of America to Uganda. You have the floor.
I think we have doctors present here. Might have needed them almost, but I have a 90-minute speech, but I'll give the 3-minute version. I just want to also stand on the protocols already observed and to say thank you, Honorable Minister Barry Munsu, for coming. He was just out of the country and he came almost from the airport here to indicate the importance and the leadership that the Ministry of Health brings to this, and DG and all the team that's been working so hard on this for so long. So grateful to the hosts, for the university and for IDI to be here among partners and friends. It's a true honor. And what we have in common is to see a healthier, more prosperous world and to work together very hard until that's accomplished. I have 3 points that I'd like to make. And the first is just to assure that the United States is committed to providing support to this effort. 1, politically, 2, economically, and 3, with people. As soon as the outbreak was announced, we not just deployed some resources and refinanced some resources very quickly, but we made people available to the response. And those people, some of them are here, and many of them are actively working at the embassy and providing support where they can. The U.S. has subsequently committed $37 million to Uganda's portion of the regional response, but $337 million, to the broader regional response. And significantly, we also pledged $50 million to the Coalition for Epidemic Preparedness Innovations to accelerate vaccine and therapeutic development targeting this strain specifically. I have here in my notes, pause for applause. That will be a game changer. We spoke about game changers earlier. Secondly, to say that the U.S. supports the plan that you've laid out, the vision that you've described, the mechanisms for pursuing it, and of course, the end goal of containing the outbreak. To that end, we support the notion already mentioned by the British High Commissioner of one plan and one team and one budget, one monitoring and evaluation mechanism. These principles minimize duplication, they strengthen accountability, and they'll keep us as partners focused on country-led priorities and measurable results. Co-locating and coordinating will turn information into action faster and enable cross-border learning and collaboration. And as this IMST stands up, I'm very excited to see how you seize opportunities to leverage cross-border skills, lessons learned, resources, And we believe the IMST has the potential to recommend resources to their best use and ensure lessons learned are shared to expand the circle of African countries that are fully prepared so we can contain this outbreak. And third, would like to just say my profound gratitude to the health workers, the frontline workers who are working long, they're working hard, they're working smart, they're tireless, they're fearless, and they are selfless. So let us not forget them at the front line as they are doing surveillance, as they are doing contact tracing, as they are doing so much, and let us be committed to supporting them. And I'll close by saying on behalf of the US Embassy, we stand with the continent, we stand with the government of Uganda, with DRC, with the other countries that are here. Thank you very much for all you're doing. Together and strengthened by this IMST, we can and we will succeed. Thank you.
Thank you again. Can we put our hand together? You know, politician messages was very, very clear. It doesn't need to be paraphrased. So we will go straight to the next speaker from the European Union. If you have a representative of the European Union in the house. Okay. So we continue now, we come to the high table. From all the species that has been spoken, so if I could summarize them, one message has been stated multiple times: one team, one leadership, one structure, one plan, one budget, one framework. Number two, the importance of this movement. It's very clear this is a movement that will go into the history. And if you are part of this, one day you say, yes, I was there. And if you missed it deliberately, you may regret because you missed this opportunity to be part of this important people. Continental commitments we have seen not only just from African countries, but from all the partners. They send a very, very strong commitment. African leadership, Africa ownership, Africa commitments, not just words, but financial commitments. 10 days ago, the head of the states, they have a very special meeting attended by 29 head of the states, vice presidents, and the prime ministers. They committed $80 million US, not shillings, $80 million US from Africans' content. That's a commitment that Africa is leading, Africa is committed, Africa is owning, and with the support from all the partners, it's welcomed. So with this, allow me now to look into the high table, and it's my privilege to invite the Deputy Director for UNICEF, which is graciously accepted to travel here to give us a few remarks. Unfortunately, the high tables, I have no authority to time them, and forgive me for that. You have the floor.
Thank you so much, Mr. MC. We'll try to keep within the borders. Honorable Minister of Health, DG, representatives of Makerere University, representatives of the governments across the 11 countries affected by Ebola, Director General and representatives of Africa CDC, our colleagues from WHO, IOM, and the UN agencies, development partners, distinguished colleagues, ladies and gentlemen, good afternoon. It is an honor to join you here today on behalf of UNICEF, not just of East and Southern Africa, but of the entire continent, as well as our colleagues at headquarters, to support the operationalization and the launch of the Continental Incidental Management Support Team here in Kampala.
Let me begin by expressing UNICEF's sincere appreciation to the government of Uganda for hosting this important platform and for its leadership in strengthening regional preparedness and response. I also recognize the leadership of the government of the Democratic Republic of Congo in coordinating the response under challenging circumstances, and thank Africa CDC and WHO and all our partners for showing solidarity and bringing us together around the shared purpose, realizing that in cases like this where emergency threatens not just national, regional, but also global health security, multilateralism still stands. The establishment of the Continental IMST comes at a critical moment. The outbreak is unfolding in a complex context marked by population movement, humanitarian needs, and operational constraints. It is moving quickly, and our response must remain proactive, anticipatory, agile, and fluid. We cannot afford to be reactive. We must continue to rapidly scale up and sustain operations to catch up with and stay ahead of the evolving context in which we find ourselves. Infectious diseases, as many of us have already alluded to, do not respect borders, and neither can our response. Efforts by member states establishing memorandums of understanding to ensure effective cross-border operations is highly commendable by UNICEF. This Continental IMST is more than a coordination mechanism. It is a strategic platform for collective leadership at all levels, political, policy, technical, and our partners who are very much on the front line delivering results. It brings together regional institutions, and again, so great to see the academia being brought into this, where research, evidence, and knowledge can be shared among member states. It helps us to anticipate risks, align actions across borders, bring together a collective strength, and make sure that we can deliver for the most vulnerable. As we strengthen surveillance, laboratory systems, case management, as we look at infection prevention and control, and community engagement, one issue deserves particular attention, which is why we are here partnering with everyone, and that is the impact on children. The current data from the Democratic Republic of Congo indicates that children, particularly those under the age of 10, are experiencing disproportionately severe outcomes, with case fatalities reaching as high as 51%. Nearly 3 million children and adolescents are estimated to be at risk in these affected areas. These figures are deeply concerning and reinforce the need for response that places vulnerable populations, especially children, at the center of our response. Children face heightened risk of separation from family. When access to care is delayed and when underlying conditions such as malnutrition, malaria, anemia, and other comorbidities increase the likelihood of severe diseases, we must give them due attention. Protecting access to essential health, nutrition, wash, education, and child protection services must therefore remain integral to our response. Our experience consistently shows that outbreaks have the greatest impact on those with the least access to services and accurate and timely information. Therefore, for us as UNICEF, emphasis on timely, accurate information, especially at community level, is critical. Reaching these populations early and effectively will be important in reducing transmission and preventing further loss of life. Our experience from previous Ebola outbreaks, having come from the one in Sierra Leone and Liberia in 2014, has shown that technical interventions are most effective when our communities are part of the process, where we engage, we inform, and build trust as partners. Building trust, addressing concerns and values are going to be critical for the success of all our interventions. I want to assure you here that UNICEF remains fully committed to supporting governments and partners across these priorities, especially in country where we already have our staff on the ground. Together with national authorities and partners, UNICEF has already deployed over 100 surge capacity across DRC and Uganda, where the risks are highest. We are also keeping an eye on South Sudan, Rwanda, and Burundi as well. And we're looking around those high-risk countries to make sure that we can support them should where the need arises. We will continue to support community engagement with frontline workers and community volunteers to deliver infectious prevention and control, as well as wash supplies to affected areas. Today, UNICEF has already, thanks to our development partners, most of you are here today, has been able to already leverage over $50 million that has already been deployed across countries. The launch of the Continental IMST sends an important signal. It demonstrates the value of regional and global solidarity, collective leadership, and coordinated action in addressing shared public health threats. Together, we have an opportunity not only to contain this outbreak, but to strengthen the systems, because resilience is going to be pivotal, to strengthen our partnerships and to trust that we will help to prevent the next cycle of public health emergencies. Let us act with urgency, solidarity, shared purpose, shared strength, shared resources to stop the transmission, save lives, protect the most vulnerable, and take Africa forward for the 2063 agenda. I thank you for having us, and I wish us all the very best as we pull this together for the children and the people of Africa continent. I thank you.
Thank you again to UNICEF. What an inspiring remarks. Can we put our hand together for her? So next, ladies and gentlemen, our next speaker, to me, that's my own assessment. She's one of the most beautiful, not just outside, but inside. She's very amazing. But most importantly, I find her to be the typical and textbook definition when we talk about collaborations. I want you to define, we have a lot of English speakers here, UK, the typical definition of collaborations in action, not just in words. So it's someone that she will represent something bigger than her name. She will represent the regional director for WHO, Afro Prof. Janabi, and also she will be representing the Director General of the WHO in Geneva. And it's my distinguished honor to invite Dr. Mary Rosley for her comments.
Thank you for this beautiful introduction. Honorable Minister of Health, DG, Vice Chancellor of Makerere University, Your Excellencies, WHO representative in Uganda, UN sister agency, World Bank, UNICEF, OIM, UNFPA, esteemed partners, colleagues from the 11 at-risk countries, and friends, all protocol observed. Good morning. Today, here in Kampala, we are not simply inaugurating a structure. We are achieving a continental engine, a global engine of solidarity, coordination, and action. As we gather here today in this beautiful space and very well organized event, let's not forget that the 17 Ebola outbreak Bujumbura in the Democratic Republic of the Congo continue to expand. As of 26th of June 2026, this outbreak has a cumulative number of 1,203 confirmed cases with 321 confirmed deaths across 34 health zones in 3 provinces. That's put the case fatality rate at 20.7%. Operational indicators have improved since we started the outbreak 43 days ago since the notification. Contact tracing rose to 80.2% nationally from 25 when we started 43 days ago. The alert investigation rate recovered to 99%. When we started, it was 20%. However, critical challenges persist. Bed occupancy is at 89.8%. National case fatality rate, as you see, has raised at 26.7. Safe and dignified burials continue to be a serious challenge. Is not yet consistent at the level we expected. The Bujumbura Ebola outbreak reminds us once again that a virus can move faster than our system if we are not aligned. It can move faster than an alert that is not investigated. It can move faster than a sample that is delayed, faster than a contact who is not followed, and faster than a border team that has not been prepared. It can travel through a market, a mining site, a transport corridor, a health facility, a household, and a border community. It moves faster through silence, fear, delay, misinformation, and mistrust. And that is why our response must move with speed, trust, discipline, and unity. But our response can move faster only if it can move through science, if it can move through trust, if it can move through communities, if it can move to discipline coordination. This is why this Continental Incident Management Support Team matters. This Incident Management Support Team is our commitment to one plan, one budget, one response. It is not a slogan, but an operating discipline. One plan to align our priorities, one budget to direct resources where they are most needed, one response to ensure that every partner, every country, and every team is moving in the same direction, stopping transmission, building resilient health system, and saving lives. The center of gravity of this response is not in this room, in this space where we are. It is in Bunia, Mongwalu, Rwampara, Nyankunde, Aru, Kampala, and every border community where this outbreak is being fought in real time. It is with the nurse putting a PPE again and again and again. The center is with the laboratory team processing one more sample every hour. The center of gravity, it is with the surveillance officer tracing one more contact. This number of 0.001% that make a big difference in our response. It with the driver moving supplies before sunrise from Entebbe to Bunia, doing 15 days in the roads. The center of gravity of this response, it with the community leader opening a door that fear had closed because they don't know what will happen to them. And finally, the center of gravity of this response, it with the survivor walking home again after all this system put in place, put a life again on his face. Our goal is to make their work faster, safer, and better supported. We must turn coordination into action. Alert investigated, contact followed, samples transported, laboratories functional, patients cared for, and health workers protected, supplies delivered on time, rumors addressed at community level, and communities listened to. On the top of this, preparedness must also be central. Ebola does not wait for countries to be ready. At-risk countries must test their system now, train their team now, strengthen surveillance now, and prepare borders now, and most of all, engage community now. Excellencies, honorable ministers, colleagues, together together with Africa CDC, WHO, we commit to make this IMST practical, disciplined, and field focused. We are not here to create another layer. We are not here we are here to unblock, align, accelerate, and deliver together as one team. Let's not make this inauguration another beautiful political event. Let this inauguration mark the moment when continental coordination becomes field impact, leaving a powerful legacy that will last for decades and for future generations. Together, we can stop this outbreak, and together, we can ensure that the next one finds Africa not surprised again, not fragmented again, not starting from zero, but ready, united, and already moving forward. Thank you for your kind attention.
Well, so can we put our hand together for, although she has a written speech, but you agree with me, she spoke from her heart. Before I met her yesterday, I thought I was privileged that I can speak multiple languages. But when I met her, I felt I don't even have many languages. She's the one of the African-born person that can speak English, French, Portuguese, Spanish, and in countings. What the blessings that we have now. Can we put our hand together for her? Thank you so much. But next, I will have a real privilege to also to introduce one of my colleagues. He is currently serving as a director of emergency and preparedness at the Africa CDC headquarters. He's a distinguished public health expert, but most importantly, he was honored by his own country to serve as incident commander for Ebola 2013. That as of today is still being considered is the biggest, largest health emergency in our lifetime, especially for those who were born before mpox, before the smallpox. But today he's not going to speak as Dr. Talbot. He's going to speak on behalf of our Director General, Dr. Jean Cassia. And I would like to remind you with one true concept. For those who are Christians, there's a divine belief that in every generation, God elevated people, leaders, who will not accept the status quo. People who will say, no, not in our time. People who will say, we don't want this to happen. One of those is Dr. Cassia. He doesn't want to, he refused to accept the status quo, and he wants the Africa health security and sovereignty agenda to be real. Reform of the global health security. Local manufacturing for Africa now, preparedness and response capacity now, workforce, all of those are put in a very beautiful document called Africa Health Security and Agenda. And we ask all of you to support it because there's no return from that vision. Healthy Africa is a healthy global health. And it's my distinguished honor to invite Dr. Tolbert to give a speech on behalf of the Director General. Dr. Tolbert,
Dr. Lou is the best politician you can find on the earth. And not only that he's a politician, but he's a great moderator. Thank you, Dr. Lou. Honorable Dr. Chris Bayomuzi, the Honorable Minister of Health of the Republic of Uganda, the Director General of Health Services of the Ministry of Health, my own dear sister, Dr. Marie Roslyn, our sister from UNICEF, Dr. Andrew, the head of IDI. A few weeks ago when I arrived here on the IDI campus, we met for the first time, and today we are here for the inaugural ceremony. The Vice Chancellor of Makerere University, representatives of the Diplomatic Code, representative of the United States government here present, and the United States Center for Disease Control, representative of the United Kingdom, and the United Kingdom Health Security, GPIGO, representative of the European Center for Disease Control, representative of the United Nations family, especially UNICEF, UNFPA, WFP, OCHA, development partners and donors, the World Bank, representative of the civil society organizations, distinguished colleagues of the IMST, that's the Incident Management Support System, members of the Fourth Estates, distinguished ladies and gentlemen, good afternoon. As Dr. Lou said, I'm here today on behalf of the Director General of the Africa Centers for Disease Control, His Excellency Dr. Jean Kashir, and the entire family of the Africa CDC, Africa's premier health agency and institution established in 2017 by 52 AU head of states and government. We warmly welcome you for this auspicious, historic occasion. I want to especially recognize my colleagues here in the room. Dr. Wessam is right here, who is the director and representative of the DG for the Northern Africa region. Africa CDC has 5 regions, not only at the headquarters. Dr. Lud is our RCC for Eastern Africa. Professor Yabom is in the room. He's leading our team in Itoris in the DRC. Dr. Matthew is leading the team here in Uganda. And all dedicated Africa CDC teams deploy across Uganda and DRC Congo. Together, we extend our sincere appreciation for your presence and our unwavering commitment to protecting the health of Africa and the rest of the world. And I also begin to extend my profound gratitude to the government of Uganda, Honorable Minister, and the people of Uganda for graciously your hospitality and exceptional leadership during this challenging period. Let me also recognize Makerere University, the Infectious Disease Institute, for opening your doors to host this physical operation of the Continental Incident Management Support Team. Our colleagues from the World Health Organization, the Office of Africa. Above all, we pay tribute to the frontline healthcare workers, surveillance officers, laboratory personnel, community health workers, barrier teams, logisticians, and the affected community. Your courage, sacrifices, and commitment remains the foundation of the response. At this moment, we gather here today under the solemn circumstances when the Ebola virus is raging. I don't want to go over the statistics because our best epidemiology provided all of the statistics about the outbreak. But I know for sure, and from my previous experience, the outbreak continues to outpace our collective response. Capacities in several domains, including surveillance, laboratory testing, community engagement, infection prevention and control. Since the declaration of public health emergency of international concern by WHO and subsequently the declaration by our Director General based on the advice of the Consultative Group of Public Health Emergency of Continental Security, we have made important progress. However, we must acknowledge that more remains to be done. To the families and loved ones who lost their lives, we extend our deepest condolences. To every healthcare workers on the field who risking their life, it is important to recognize that. Today, I stand before you with one clear message. No country stands alone. Africa stands together. Our colleagues gave the definition and what the IMST means. This concept was born during the MPOX. At the time, I was not with the Africa CDC. But when I got in, I learned so many stories about the difficulties of getting the MPOX coordination together. Today, the leadership of Africa CDC and WHO, both in the Africa region and externally headquarters, came together and said the IMST is the way to go. So immediately, when Ebola struck in DRC and Uganda, our leaders came together and said we would do one thing. We learned lessons from MPOX, and we must capitalize on those lessons and move forward. And so immediately, Director General Kashier flew here to Uganda after a trip I was with him when we were in Bonia, Ituri. And when he got here, Your Excellency, he visited your president. And that commitment was crystallized, and the government of Uganda demonstrated leadership. And that's why we are here today. But it is not unprecedented. The reason it is not unprecedented, the first time Africa came together and the whole world came together was the time the 2014-2016 Ebola outbreak in West Africa. African Union formed a support team that went to West Africa called the ASIOA. ASIOA deployed hundreds of medical doctors, nurses, public health professionals in Guinea, Liberia, and Sierra Leone. I was the incident manager then, and I hosted them. From that experience in West Africa, today, I'm working for a continental premier institution to do exactly what we prepare for today to build resilient healthcare system on the continent. I think that worth commendation. This experience laid a foundation for establishing Africa CDC. Today, Africa's health security and sovereignty agenda is making tremendous progress. We have heard so many predictions about this outbreak, that we might have an outbreak that we cannot end and the disease might be endemic. There are also outbreaks that may go out of control. There are predictions that it will affect so many other countries. But it's not the first time we're hearing these predictions. In West Africa, we heard predictions that the cases would have been over 2 million infected people and 250 deaths. That was the worst Ebola outbreak, but the cases stopped at 28,000, not 1 million or 2 million. Then the cases also, the deaths stopped at, though very, very grievous, stopped at 11,000 and not 250,000. So the system we're putting in place today is intended to stop the outbreak in Ituri. And we have the resources, the mechanism to do that with the collective efforts of all of us here sitting in the room and the host countries. So on behalf of the Africa CDC, I reaffirm our unwavering commitment to the government and people of Uganda, the Democratic Republic of Congo, and our sister countries that are here today for cross-border preparedness. We commit to sustain technical, operational, and financial support. Africa CDC commit to transparent coordination through the Continental Incident Management Team. Africa CDC have already deployed healthcare workers on the field, hundreds of them across Uganda and DRC, and preparing other countries. We commit to real-time information sharing and joint reporting with our WHO counterparts. And above all, we commit to ourselves to protecting African community, especially the most vulnerable. Asante sana. Thank you.
Can we put our hand together for Dr. Talbot? If I have to summarize both two last speakers, 4 things. They demonstrate to all of us the symbols of unity. Number 2, they demonstrate symbol of leadership. But most importantly, the symbol of African resilience. But last but not the least, symbol of hope that good things is yet to come. Thank you so much for our speaker. Let's give them a big round of applause. But ladies and gentlemen, the time that we've been waiting for has finally arrived. That we will have the official launch of Ebola Incident Management System to be officially unveiled and launched. And this is, to me, is a proud moment for the people, for the government of Uganda. We have 11 countries represented here, including the DRC. I would like them to stand up one more time for their solidarity. That's this launch that will happen and will be launched by the government of Uganda, by the most beloved ministers, you are aligned with it. Please raise all of you. Thank you so much. And with this, Honorable, and with your permission, allow me to invite our Director General of the Minister of Health, Dr. Charles Olera, to come forward to officially invite the guests of honor. And after that, the celebration is not going to end. There will be so much surprises after official lunch, but I'll come back to you on this. Dr. Charles, over to you.
Thank you once again, Honorable Minister. I don't really want to delay what we have been waiting all that time. I would just really want just to invite the Honorable Minister to address us and officially launch the incident management support teams. Honorable Minister.
So thank you very much, DG. I recognize and respect the fact that you have risen to receive me. Thank you very much. You can get seated. So, Your Excellencies, let me say in the interest of time, I observe the protocols already registered. One time in my village, for us as the political leaders, we address many functions. And LC one chairman came to give a speech. And then he began with the minister, then the local leaders, then he got confused with the leaders who were there. So for him, all along, he knew the word protocol means political. So he said political observed. So for him, he observed the political. So if I borrow from my chairman there in the village, I can also say political observed. But he wanted to mean the protocol, so that he confused it. But I recognize all of you, CDC, WHO, the UN agencies here, the bilateral partners, and all of you distinguished partners. Makerere University, the Vice Chancellor is here, but I must also acknowledge my former teachers, Professor Reverend Ruboga is here, Professor Nelson Sewankambo is here, and others in the room. Otherwise, if I don't do that, you might remove some marks from my exam results, which probably you gave me some time back. Let me start by saying I'm very happy to be here at Makerere University. I came here as a young boy to study medicine. I was young and innocent. A number of years back. Later on, I came back to postgraduate, but also when I was a senior officer with the UNFPA, we started a program, the Department of Population Studies. I came and was a past-time lecturer. We had begun a master's program in population and reproductive health. So I used to teach in the Department of Population Studies and also School of Public Health. So I am happy to be back in Makerere now as a Minister of Health. Many speakers who came here, going through protocol, they would start with the Minister of Health, then I would look around whether the Minister of Health is around. Because I have just been appointed and I'm not yet used to be referred to as the Minister of Health. So whenever you would say Minister of Health, then I would look around. Then I realize I am the one. Because the ink that signed my appointment letter is not yet dry. And this is my first public event in Uganda, yes. So meaning that in whatever I will be doing, I will attach a lot of importance to the issues that we are discussing today. So I am happy to be here, and thank you all for finding time to be here this Saturday. Usually Saturdays, people would want to relax and catch up with their families and do lots of things, but the mere fact that we are all here shows the commitment that all of us have and the importance we attach to the discussion that we are having this morning. When you become a big man, they prepare for you a speech. But of course, you go through it and agree with it. So others have been given 3 minutes, but since I am the chief guest, I want to invite you to mobilize patience that I go through my remarks, and then we shall unveil and officially launch the IMST, which has brought us here. It is my great honor and privilege to welcome all of you to Uganda, for those who have traveled from outside the country, for the official launch of the Continental Incident Management Support Team, which I will abbreviate as IMST. So when I refer to IMST, I am referring to the Continental Incident Management Support Team that we are launching today for the Ebola Bundibujo response. Uganda is proud to host this important continental platform. It reflects our shared commitment to protecting the health and security of our people, and demonstrates that when Africa stands together, we are stronger than any outbreak. I would like to begin by expressing my sincere appreciation to our President, Yoweri Kaguta Museveni, President of the Republic of Uganda, for his unwavering commitment to health security and for accepting Uganda to host this Continental Incident Management Support Team. His leadership has enabled Uganda to provide not only a home for this important coordination mechanism, but also an environment where experts from Africa CDC, World Health Organization, and other partner organizations can work together in support of member states across Africa. Actually, our president is well known for his strong support for public health interventions. If you recall, for instance, the story of HIV and AIDS, when many countries were in denial and did not want to say we have a challenge of HIV and AIDS, it is President Yoweri Museveni who sent the Minister of Health, Dr. Rakana Rubunda, then to go to Geneva at an assembly of WHO to announce to the world that Uganda has a challenge. And he was accosted by his colleague presidents and said, why do you tell the world that you have HIV and AIDS? Tourists will stop coming. Investors will not come. Say, no. And his response was, life first. And therefore, we appreciate him for that leadership and also for having allowed that we host this facility. Today's event is much more than the opening of an office. It marks another milestone in strengthening Africa's capacity to prepare for, detect, and respond to public health emergencies through coordinated leadership and genuine partnership. The IMST has already demonstrated its value during the Continental Mpox response. Faced with an unprecedented public health emergency, Africa CDC, WHO, member states, and partners came together under a common vision built on one team, one plan, one budget, and one monitoring and evaluation framework. This model strengthened coordination, improved accountability, reduced duplication, accelerated resource mobilization, and enabled countries to respond faster and more effectively. Today, we are applying these lessons to the ongoing Ebola Bundibujo outbreak affecting our region. The IMST represents a new way of working, one that places countries at the center while leveraging continental solidarity and global partnership. The significance of the IMST rests on 4 fundamental principles. 1, African leadership. Africa must continue to lead the response to health emergencies affecting our continent. National governments remain at the center of decision making, while Africa CDC and WHO provide technical leadership, coordination, and support that reinforce national ownership. I officiated at the closing ceremony of the conference we had in Dar es Salaam, where we're discussing NCDs, the non-communicable diseases. And we had a number of ministers of health. I reminded them that when you look at the map of Africa, we don't have it in the room, but you can imagine the map. It is shaped as a question mark with Madagascar as a dot down there. And the implication, in my own view, is that the mother continent is posing a question to all of us. And I was telling the ministers of health, we have all these challenges, communicable diseases, like Ebola, non-communicable diseases, and the disease burden is high. And the continent is posing a question to us as health ministers and as leaders in the various spaces. What is it that we can do to ensure that we improve the quality of life of the people in Africa? And therefore, epidemics and outbreaks like these challenge us that as governments, we in Africa, we must provide the leadership so that we can guarantee and ensure the health of our people. And I want to thank all the partners here present for the support. But we, the leaders in Africa, must provide the leadership in order to ensure that our people are safe. Second, the other fundamental principle is partnership built on complementarity. The collaboration between Africa CDC and World Health Organization and other partners demonstrates that our institutions are stronger together. And our sister from UK was making reference to the different proverbs and the saying that we have here in Uganda that speak to the power of partnership, the power of unity, the power of collaboration. So meaning that when you act alone, you can't do much, but if you work together, you are able to register progress. Working as one team ensure that partners align behind the national priorities, maximizing impact while avoiding fragmentation and duplication. The third fundamental principle is operational excellence. The IMST enables the rapid deployment of experts, harmonized technical guidance, coordinated surveillance, laboratory strengthening, case management, infection prevention and control, logistics, risk communication, and cross-border collaboration. It transforms coordination into action. Fourth, preparedness and solidarity. Every outbreak reminds us that diseases do not respect borders. These diseases do not require a passport to cross from one country to the other. I come from a district which borders DRC, and our communities there, much as when you draw a map, You say this is the boundary, this is the borderline, but our communities coexist. During the days of COVID, I went to my district of Kanungu and I found the RDC, the local leader, had arrested many women and children, and they were being kept in an isolation center. And I asked him, why are these women there? So no, they crossed into DRC. When I asked the women, what were you going to do? They said, no, we're going to our gardens. Because at that community, you find the home is here, then the banana plantation is across in the DRC, and the garden of beans. So they were crossing to go and harvest their crops and come back. So I asked the RDC, are you sure in terms of public health, this is a risk? Because this woman just crossed, picked the food from the garden and went back home, didn't interact with anybody. So what is the reason behind arresting her? I said, no, but you as government, you have said nobody should cross and so forth. For him, he was implementing mechanically. But these borders, when you look at the border communities, the borders are not there. They are not there. People live together, the borders are porous, and of course, while that is a reality, but also presents a challenge in one way or the other. So every outbreak reminds us that diseases do not respect borders. That's why the challenge we are managing here, the challenge of imported Ebola, as we all know. Our preparedness and our response must therefore extend beyond borders. Through the IMST, countries share expertise, resources, and operational capacity to protect not only their own populations, but the health security of the entire continent. While today marks the official launch of the IMST headquarters in Kampala, the work of the IMST did not wait for a building to begin making a difference. From the very first days of this Ebola outbreak, the IMST has been fully operational, supporting both Uganda and the DRC in rapidly scaling up the response. Together, we have witnessed the deployment of tons of life-saving supplies, including laboratory equipment, diagnostic reagents, personal protective equipment, essential medicines, laboratory consumables, and many other critical commodities. These investments have strengthened frontline health workers, accelerated laboratory decentralization, and expanded access to quality care closer to affected communities. We have also witnessed a holistic achievement in regional cooperation. Through the IMST, Uganda and DRC have strengthened their collaboration by signing a memorandum of understanding that allows our teams to work together across borders. Joint laboratory services and Ebola treatment centers are now being established in Aru and Kasenyi, where health professionals from both countries will work side by side to detect cases rapidly, provide quality care, and stop transmission at their source. We have agreed with the government of DRC that we shall establish up to 4 treatment centers on the other side of DRC, because as you notice, the challenge we've been having is that our sisters and brothers in Congo have been coming here for better management and treatment. They have a strong belief, and maybe justifiably so, that, and some even think we have a cure for Ebola here in Uganda. So they have been attracted to come and seek care in Uganda. And our president spoke with the president of DRC, and they agreed that through this collaboration, we establish treatment centers near the border points so that the Congolese can get that care which they come for here, they get it from within their territory. Hopefully that will reduce the numbers of Congolese who come into Uganda to get care for this Ebola disease. And I want to thank our teams, the partners with whom we are working to ensure that that happens. As we often say, we cannot keep mopping the floor while the roof is still leaking. And I think this is a very important point, that the epicenter of this outbreak is Mongwaru. It's a mining town in Ituri province. And I think most of the cases in DRC are in Ituri province. Although there were reports that North Kivu and South Kivu also registered some few cases, but the concentration is in Ituri. Over the 20 confirmed cases we have registered as a country, 15 are Congolese. I think 15 were Congolese who came into Uganda to seek health care. I think 4 are the health workers who mainly managed the index case, the first case, because when that patient came in, it was managed and the health workers didn't know it was Ebola. It was confirmed when he had died because he came in on the 10th of May, hospitalized at Kibuli Hospital, died on the 14th, and the Ebola was confirmed on the 15th of May. So 4 health workers. Then I think 1 is a driver who transported that first case. So we're basically managing and dealing with imported Ebola from Congo. That means even if we do everything possible here in Uganda and we don't get any active case, you can't be comfortable because across in Congo, if there is active transmission, then you still have a risk of having those cases. And that's what the statement means, that we cannot keep mopping the floor while the roof is still leaking. So we must also fix the roof. And that explains why we have a strong collaboration with our sisters and brothers in the Congo. So together we handle this as a regional problem of Ebola. As long as transmission continues on one side of the border, all neighboring countries remain at risk, and we are happy to see our friends from the other countries which are at risk being here represented. Our response must therefore address the source of the outbreak while simultaneously protecting our borders. This is precisely the spirit of the IMST, transforming political commitment into operational collaboration. Our borders should unite our response rather than divide it. By working together, sharing expertise, resources, and information, we can stop outbreaks where they begin and strengthen the health security of the entire continent. I am in touch with the Minister of Health in the DRC, and in a few weeks to come, we shall together go to Ituri to show that political commitment, the togetherness, and also mobilize the communities so that we can jointly address this challenge of Ebola. So preparedness remains equally important. While responding to today's outbreak, we must also prepare for tomorrow's threats. That is why Kampala is currently hosting a regional preparedness workshop, bringing together high-risk districts from Uganda and neighboring countries surrounding the Democratic Republic of the Congo. By strengthening surveillance, emergency coordination, laboratory networks, and cross-border preparedness, we are building stronger health systems capable of responding rapidly to future outbreaks. Uganda is equally proud to contribute through its strong national institutions. The National Medical Stores and the Strategic Logistics Hub in Entebbe are becoming critical regional assets, supporting the rapid movement of laboratory equipment, medicines, personal protective equipment, vaccines, and other essential commodities. These facilities will continue supporting Uganda, DRC, and other affected member states, ensuring that life-saving supplies reach the frontline responders quickly and efficiently. These achievements demonstrate that the IMST is not simply a coordination mechanism. It is an operational platform that transforms solidarity into concrete action, delivering expertise, supplies, and coordinated support wherever they are needed most. Before I conclude my remarks, I wish to recognize the remarkable leadership that has made this partnership possible. First, my own team in the Ministry of Health, led by the Director General and the Permanent Secretary, because there has been a time of transition when the outgoing ministers had gone and the incoming ministers were on their way. And the Permanent Secretary and the Director General were taking charge of the sector, and I would like to appreciate you honestly. I also would like to appreciate Dr. Jean Kasser, the Director General of Africa CDC, for his visionary leadership in strengthening Africa's emergency preparedness and response architecture, and for championing African leadership in public health emergencies. CDC, we want to appreciate you. You've been on top of the situation and convey our appreciation to Dr. Jean. I would also like to register our appreciation Professor Muhammad Yakub Janabi, the Regional Director, World Health Organization, Africa Region, for his steadfast guidance and continued support in advancing Africa's health security agenda. We were together in Dar es Salaam and we had a big conversation, so we'd like to register appreciation for his steadfastness and for the leadership he has provided. Please convey our appreciation, as well as Dr. Tedros, the DG, WHO Geneva. He was here. We had a meeting with the HE, the president. Would want to register our appreciation and the global leadership that he has provided in managing this outbreak and many other health challenges as we know them. The Ebola outbreak reminds us that no country is safe until every country is prepared. It also reminds us that solidarity is not simply a principle, it is an operational necessity. The IMST embodies this spirit of solidarity. It brings together governments, continental institutions, international organizations, development partners, scientists, clinicians, and frontline responders under one common purpose, protecting lives. And I would want to appreciate all of us who are gathered here because our aim is one, to protect the lives of our people. As we officially launch this facility, let us renew our commitment to partnership, accountability, innovation, and African leadership. Let us continue investing in preparedness, strengthening our health systems, and ensuring that future generations inherit a continent that is better equipped to face emerging health threats. On behalf of the government of Uganda, I once again want to thank Africa CDC, World Health Organization, our development partners. Many of you are here, and all frontline health workers for your extraordinary dedication and service. Before I just give the final comment, permit me to just raise a few concerns which are not part of the written remarks, but I just want to register them. One, okay, there has been some improvement, but let me still report it. I have been a minister in charge of information and communicating for government before I came to health. And I have been following the communication about Ebola in the international space. And whether it's WHO, CDC, or the media, you've been reporting in a manner that you lump DRC and Uganda together. They say the outbreak in DRC and Uganda, now we have 900 cases reported. Now they are over 1,000 in DRC. Then the deaths, then they were saying, now they are over 100. Now to an observer in the US, in Canada, and Europe, will think the situation in Uganda is the same as the DRC. I think there is a need to distinguish the situation in the DRC and the situation in Uganda. We are not denying the fact that there is a problem here, but I think it is better that you say Uganda has 20 registered cases, whereas DRC, I don't know the count today, but they are over 1,000. Only 2 have died in Uganda out of the 20. Of the 20, 15 are Congolese nationals who don't reside here, but they came here for treatment. I think those figures are important. So I would want to make this appeal that yes, we have the commitment to address this challenge, but I think in terms of reporting, let's show that distinction. But I think now there has been a change, because the other day when we had a virtual meeting, our vice president, who represents the president, also made that important point. Now, the second concern or issue I just want to raise is that some of you represent countries which have imposed travel restrictions, stopping your citizens from traveling to Uganda, but also making it difficult for somebody who is in Uganda to travel to those countries. Now, Ebola virus disease was first identified in 1976 in the DRC and South Sudan. So it is 50 years old. In Uganda, we are now witnessing the 9th outbreak, the first one having been in 2000. They vary in terms of intensity and strength, but this is the 9th. I think in Congo, they're having the 17th. These outbreaks and flare-ups have been mainly in Africa. Not mainly, but they have been in Africa. And I think we have had up to maybe 40 outbreaks and flare-ups of Ebola. But the statistics show that of all these outbreaks, there are less than 30 cases of Ebola that have actually been exported outside Africa in the last 50 years. And an examination of who these cases are is mainly doctors and health workers who have been taking care of patients, or those who have been closely taking care of the patients of Ebola. So now I want to raise a challenge. Speaking from a public health standpoint, are those decisions by your countries therefore backed by science? Or is just out of fear? if for the last 50 years, we have had up to 40 outbreaks and flare-ups, but only less than 30 cases of Ebola have been exported, and also mainly those cases being health workers and caregivers who have been close to patients. So there is a need to review these restrictions, because decisions which we make, they must be backed by science, not out of fear. Don't you think if we put the SOPs, standard operating procedures and public health measures in our various countries, the airports and entry points, we can still allow travel, and then we just remain vigilant and contain and manage this challenge of Ebola? I am now speaking as a public health scientist. So I would want to make an appeal, because the last time we counted, there were over 20 countries which have imposed travel restrictions. So we needed to put on a public health lens and interrogate those decisions, whether they are backed by science or they can still be reviewed as we manage and contain this outbreak. The other day we had a meeting with the managers of airlines. We had also invited the ambassadors. Some came, but I think we need an engagement on that as we strengthen the effort and the response to contain and manage this outbreak. How do we, at the same time, use the science to make rational decisions, but also not injure the economies of the various countries? So I thought I should register this so that we take it as food for thought, since you, the experts, are here this morning. My third and last concern or comment would be that, yes, this morning when we met in the room up there and as we gather here, we are very happy and encouraged by the partnership. And actually this event is speaking to a stronger partnership, manage and contain these diseases, specifically in this case, Ebola. So we'd want to urge that we continue to strengthen this coordination, this partnership. That means we should all speak to a harmonized plan, because also it's not enough to have many partners, lots of resources, but when they are speaking to different plans and different priorities. I can give you two examples in Uganda. Like I said on HIV and AIDS, we first acknowledged it in the early 80s. We registered high prevalence rates. I remember in the early 90s, we recorded the prevalence rate among pregnant women attending antenatal clinics to the level of 30.5%. In the general population, it rose as high as 18.5%. And through the 90s, both prevalence and incidence rates considerably came down when there were few partners and little money. Now, in the 2000s, when we got many partners and more resources, at one time Uganda almost had the highest per capita allocation of resources to manage HIV/AIDS. The prevalence rate and the incidence rates, if you have to be realistic, you can say stagnated. If you have to be diplomatic, you can say stabilized. If you have to be an epidemiologist, you can say the curve flattened. But basically, with more partners, more resources, we didn't see a substantial decline like the way we saw before. That can speak to many factors, but I think the issue of coordination, harmonization, speaking to one plan, working as one team is a very important point. So as we come together to address this outbreak and many other challenges, we would want to we call for strong coordination and the teamwork. The other example that I can give in Uganda is that we had the war, civil war and social disruption in the northern part of Uganda for close to 20 years. As the war came down, again, we got many partners coming to support with resources, many partners highly appreciated. But again, the impact indicators were not improving. We are not in the change in the impact indicators was not commensurate with the strength of the partnership and the resources being invested. Again, that can speak to many issues, but again, the issue of coordination, partnership, working together, having a harmonized plan, which captures the interests and priorities, investing in high impact interventions, because you can put in resources, but probably you are investing in low impact, high cost, but low impact interventions. So it becomes very important that we work together. And I want to give assurance that the Ministry of Health will do all it takes to provide the leadership as government. I just end with this small story. There are two animals, a pig. The Muslims forgive me because it's not a good word for those who have Muslim faith. A pig and a chicken were arguing because both of them provide food for humankind, especially for breakfast. So the argument was, who the two of us is more committed to ensuring that the human being remains happy when he goes for breakfast. And then the chicken was saying, for me, every time I lay eggs, this man takes the eggs and either boils them or puts scrambled eggs or does omelette. Every time I give eggs, I make the man happy. Then the pig said, for you, you lay eggs. For me, the human being likes bacon. And for me to provide the bacon, I have to die. So mine is total commitment. So I want to assure you that from the Ministry of Health, ours is total commitment. And we shall work together to ensure that we stamp out this outbreak of Ebola and many other health challenges. I am telling a number of colleagues, many people use the phrase that as a minister, my door is open. I want to say I have no door. I have no door. So feel free to engage with us. We are there, supported by a very strong team, and let's work together to ensure that we address the quality of life of the people that we serve here in Uganda, in DRC, and the other countries which are at risk of Ebola disease. So thank you very much. Now, one time I was in Zambia.
Recording stopped.
IMST. So let me now start. Prepare yourselves now for the start of the launch.
Recording in progress.
So now they have provided me a writing which is written in red to show that what we are doing is very serious. And one who has written has said, I should say, by the authority in me, I hereby declare that the Continental Incident Management Support Team, IMST, for Bundibujo virus disease is officially launched. So the process of launching starts now until when we cut the ribbon, then it will be fully launched. So thank you very much. May God bless all of you. And thank you once again for finding time to be here with us. And let's continue working together to stamp out Ebola and many other challenges. Thank you very much.
Put our hand together for the Honorable Minister for graciously, finally, the IMST is officially opened. You may ask them to sit down. Now we have we have not yet finished. So in life, they say sometimes good things, unfortunately, can come into an end. So, Honorable, the phase 1 of the launch of the Continental IMST has come to an end. But we have phase 2, we have phase 3, and phase 4. And please be patient. The phase 1, we talk about being part of this story. So we will invite not the modified photographer, really photographer, to make the photos for the history of the launchings. So we will have faces also for the photos. The first will be the high table. Phase 2 will be the front and the second launch will join the high table. Phase 3 will be all the 11 countries that are represented here. They will come also to front to take a photo with Honorable Minister, because when you go home, you don't deny that you're not part of it. So you must document it. And then phase 4, all of us to be documented, but not the ends yet. Honorable Minister, we heard you. Now, in terms of coordination, you have only a sister and a brothers who are the co-chair of IMST. When it comes to any challenges related to the data, related to the response, today with this declaration, you become the head of those two co-chairs. And I feel to you also, we may designate a temporary office for the Honorable Minister if he want to come and see the progress of the IMST responding to the continental response. You can also come and share it from these buildings. So you are representing all the 55 ministers, and anything at any given time, the co-chair, they are under your disposals. And I believe even for them to get the exit visa, they must also consult you, and you need to know where they are at any given time. So the first 4, we will also do it phases. We will, because we are dealing with Ebola, and we may have some contacts. So, so when we go up, we do it also phases. the 2 rows in the high table, they will go first to do the cutting and do the clearance. And then phase 3 will be almost everybody. That's during the tour. After that, very few people, all the partners of the IMST, the WHO, the Africa CDC, they will go to also to do the phase 2 of the launch of the medical regional hubs, which is fully furnished, fully allocated by the government of Uganda. Can you put our hands together for this? From the staffing, from furniture, from building, and I was told it's beautiful and beautiful. So you must go there also and see. Okay? So photographer, phase 1. So yes, it's one here for the actor. We want to Finger challenge.
Recording stopped.